Welcome to the other side of Lucy Letby. In episode 72, we're going to look at the latest news and have another look at BBC. So we now have summaries from an international panel of medical experts on all 17 babies that featured in the 10-month trial involving Lucy Letby. And our lawyer, Mark McDonald, delivered the findings to the CCRC Criminal Cases Review Commission, I think on April 3rd. So now we see what happened. So let's just go over again what the panel concluded. For baby 1, that child A, baby A in the trial, prosecutors said that the boy was murdered by injection of air into the bloodstream which caused an air embolism, where bubbles form and block blood supply, according to Dowie Evans. But the panel found no evidence of air embolism and said that the baby died from thrombosis, where a blood clot formed in a vessel. And as we recall, that vessel was the portal vein. So the portal vein is a major blood vessel in the body that carries blood from the gastrointestinal tract, the gallbladder, pancreas and the spleen to the liver. And there are two big veins that join together to form the portal vein. That's the superior mesenteric vein and the splenic vein. And in an adult, the portal vein will carry roughly 1.2 litres per minute, which, if you do your sums, is about 1,700 litres a day. So that's where this clot was found in baby A, that no one mentioned during the trial, and that I believe was caused by the umbilical venous catheter that was left in for 7 hours with no fluid flowing through it. The APS, the antiphospholipid syndrome in this mother may have contributed to it, may not have, but it doesn't really matter. And then we had baby 2 or baby B. The prosecution said Letby attempted to murder baby A's twin sister by also injecting her into her bloodstream. But the panel found no evidence of her embolism, obvious, and said that the baby had collapsed from thrombosis. I didn't pay too much heed to baby B, because there's very little about baby B in the public record. And even though I could have access to the medical chart, I've always said I wouldn't do that because it gives me an advantage that other people don't have. And I maintain that you don't need access to the records. You only need access to the public record to know that Letby was stitched up. But thankfully, baby B didn't die. At some point, no doubt I will look at it and see what happened with baby B, but from what I know, mercifully baby B is alive and well. Baby 3 or baby C, who is very interesting from a medical perspective, sadly died. Prosecution said the boy was murdered with air forced down his feeding tube and into his stomach. The panel said that the baby died following ineffective resuscitation from a collapse after an acute small bowel obstruction that went unrecognized. Now, this is extremely interesting because the post-mortem cause of death given at the trial was widespread hypoxic ischemic damage to the heart and myocardium due to lung disease with maternal vascular underperfusion as a contributory factor. And here we have the experts saying that one of the causes of death, or a big contributor to the cause of death, was an acute, meaning sudden, small bowel obstruction that went unrecognized. Now, if we look at how can you get from small bowel obstruction to myocardial damage or damage to the heart and lung disease, how can those things all work together to reach the same conclusion? In other words, two pathologists coming up with two different explanations for how death occurred. Well, the first thing we have to remember about baby C, baby C weighed 800 grams and was 30 weeks gestation. That means baby C was below the third centile for weight of that gestation. And below the third centile simply means that there are only 3% of babies born at 30 weeks that are below 800 grams in weight. And that tells you, without knowing anything else, that BBC went a very long time in the womb without a good blood supply. So the pathophysiological cascade or causal chain that would have to happen to create this widespread ischemic heart damage and link it to the acute obstruction of the small intestine would go something like this. The first step would be the pneumonia or the lung disease that's causing a reduction in gas exchange. So that's going to result in not enough oxygen in the entire system or hypoxia. And the two biggest consumers of the oxygen in the body are going to be the brain and the heart. So immediately, no matter what way you look at it, we have oxygen starvation of the heart from the pneumonia alone. And that may have been sufficient to cause death in the baby, and it would certainly have been sufficient to cause a collapse in the baby. But we remember all of the green bile, bilious vomiting, loads and loads of vomit all over the floor that was coming from Dowie Evans. So there was obstruction involved somewhere along the line. And this is one of the times when Dowie might have got close to getting it right, but sadly for him, his method and mathematics are all wrong. The small bowel obstruction is going to cause gastrointestinal distension, and that's going to raise the pressure inside the abdomen. Now, one of the ways that the body will attempt to lower the pressure inside the abdomen is to vomit. So the obstruction in the small intestine will eventually work its way up pressure-wise to the stomach and stop food going further down, but also force food out to try and relieve the rise in intra-abdominal pressure. But it's not going to be very efficient at doing that again because we're talking about a preterm baby where everything doesn't work that well. And we all know what it's like to feel bloated and uncomfortable. But that's about the height of what a mild obstruction will do to us. What the abdominal distension will do to the baby is, funny enough, splint the diaphragm. So splitting the diaphragm is a thing. And that's going to reduce the expansion of the lungs, which is going to further reduce the gas exchange, which is going to further increase the hypoxia. So this is just another example of one of these doom loops that you can get yourself into. But the rise of the abdominal pressure does something else as well. It reduces the venous return to the heart. So remember that the venous side of the body is a low pressure system compared to the arterial side of the body. And any increase in pressure around the veins, which doesn't have to come from the vessels themselves, it can come from any area around the vessels where the pressure has risen up. That rise in pressure will be transmitted into the veins and it will slow down the return of those veins to the left-hand side of the heart. And this affects what's called the preload of the heart. So the preload is the initial amount of blood that goes back to the left atrium and the left ventricle before it contracts and fires it back out again. The afterload is the amount of blood that's left after the contraction that didn't completely clear the chamber. But a reduced afterload would simply mean that it requires less blood to fill the heart up the next time. But the preload is going to determine how efficient each beat of the heart is. So when you have your venous pressure reduced, you have your preload reduced, then each beat of the heart is not going to pump out as much oxygen or as much blood as it should do or as it would normally do. And one of the organs that will suffer most from that is the heart itself, being one of the biggest consumers of cardiac output. And we all know what happens when the hypoxia builds up. When the hypoxia builds up in the blood, the lactate builds up in the blood, because we're now producing energy anaerobically. And when the lactate build up in the blood, what else builds up in the blood? Acid builds up in the blood. And when acid builds up in the blood, it impairs the function of the heart contractions. So therefore, the cardiac output falls even more. Now, the coronary arteries will dilate to try and compensate for this, But because we now have hypotension, we have low blood pressure, that dilation will not really make an awful lot of difference to the total perfusion. The problem is the heart itself. So there's two components. First of all, we have the hypoxia from the lung disease, now compounded by the hypoxia from the reduced venous return caused by the obstruction in the bowel. But then we have to throw in another kicker, and that's a phenomenon called bacterial translocation. So, as we all know, the gut is full of bacteria, and normally they'll be confined to the right location. But with the obstruction and the build-up of all of that bacteria, and particularly the endotoxins, these are toxins that come from the breakdown of the bacteria or also the metabolism of the bacterium itself. They're all now building up behind this obstruction. And the rising pressure of this causes these bacteria to translocate, to move through the wall of the gut out into the systemic circulation. And that causes a thing called a cytokine storm. So remember, the cytokines are simply the little signaling proteins, usually in the immune system, that they're turning information up and down. That's the process of controlling information inside the body. That's now gone because being overwhelmed by this translocation of bacteria. But what a cytokine storm will do is massively increase the demand for oxygen. Or, in other words, it will raise the basal metabolic rate. But we can't supply that increase in demand anymore unless we further divert it from the heart. Now, this obstruction will be what's called a functional ileus. And a functional ileus simply means that there's no actual pathology present at the site where the obstruction is. It's simply that the bowel itself isn't working. With autopsy, the widespread myocardial damage is going to reflect prolonged oxygen deprivation that's happening in the womb even before the baby's born, not acute infarction. The lung pathology in pneumonia, you're going to see consolidation, you're going to see RDS, and you're going to see signs of respiratory failure. But because the ileus or the obstruction in the baby wasn't due to a pathology in itself, post-mortem, that's going to go away. And as all of the fluids and everything inside the body settle, there may not be any sign at all of an obstruction because it was functional. It wasn't an actual thing that was blocking the movement in the gut. It was the fact that the gut itself wasn't moving. So that tells me that by the time that the baby C was producing these green bilious vomits and all of that stuff, the baby was so far from stable. It was already severely compromised. The obstruction was a consequence of that, which further fed into it and caused the collapse. So you could say that the obstruction was the final act. And you might argue that if the baby had been in the right place, had the right treatment and support, diagnosis and all of that, that the baby could have survived pneumonia, but because it developed the functional ileus, it was just too much. So all of these histological findings, these pathological findings will be present, documented, photographed, etc. at post-mortem. And then it comes down to interpretation. And we remember that in the case of BBC, Dr. Marnarides didn't disagree with Dr. Kokai, that these were the main findings of the post-mortem. And in fact, he initially agreed that that was the cause of death, widespread hypoxic ischemia to the heart and myocardium. But he changed his mind after he was updated on the clinical findings at the time, which was the abdominal distension, which happened on the 12th of June when Lucy Letby wasn't there. So this cascade here of increased intra-abdominal pressure, reduced venous return, reduced cardiac output, doom loop cycle was happening on the 12th. But to show that Lucy Letby couldn't have done this by topping up or an extra dollop on the 13th, we have to actually look at some numbers. So the normal intra-abdominal pressure is between 0 and 5 millimeters of mercury. To splint the diaphragm, you need between 15 and 20 millimeters of mercury, not between 0 and 5. So if we look at the stomach of a 30-week neonate, that's 800 grams, the capacity of the stomach is between 10 and 20 mils. And by doing a little bit of calculations, you can work out that to increase the intra-abdominal pressure in that baby to 20 millimeters of mercury that would be needed to splint the diaphragm, you would have to have between 30 and 50 mils of air. But you wouldn't just have to deliver it, you would have to sustain it. So even though a 60 mil syringe that's hanging around the place is more than enough to deliver that amount of air to cause the intra-abdominal pressure to rise to 20 millimeters of mercury, that's not going to last, because that is pressure caused by the air is simply just going to leak out of the baby and will have to be constantly replenished to maintain the pressure at 20 millimeters of mercury. Otherwise, you have no splinting of the diaphragm. So Dowie Evans' extra dollop of air is a load of hogwash. And then we have to take into account the fact of the compliance of the tissue. So this would be the elasticity of the gut and the elasticity of the abdominal wall. And in a preterm baby, that's very compliant. There will be an awful lot of expansion of that gut without an elevation of pressure. So the extra dollop of air is what it is. And the findings of the pathologists and the findings of the international panel correlate perfectly well with what happened to the baby and explain perfectly well what happened to the baby without having to concoct these fantastical methods of sustaining pressure and splitting diaphragms and all this stuff that Dowie Evans did in a shameful way. Then we get to baby 4 or baby D. Prosecution said the girl was murdered by the injection of air into the bloodstream. The panel found no evidence of air embolism and ruled that the baby died of systemic sepsis, pneumonia, and DIC, disseminated intravascular coagulation, that's blood clotting throughout the system, and issues with failure to give relevant antibiotics were also identified. And we know that there was a delay in treating baby D's mother's premature rupture of membranes, and there was also a delay in giving the baby antibiotics after birth. And then baby 5 or baby E, the Crown said that Letby murdered the twin boy with an injection of air into the bloodstream, and she also deliberately caused bleeding in the infant. So this was the little baby that bled to death. But the panel said there was no evidence of air embolism, which there wasn't, and bleeding was caused either by a lack of oxygen pre-birth or a congenital blood vessel condition. Now, because we have no post-mortem on baby E, these findings can only be speculative. And again, this is all down to the particularly vulnerable state of these babies in their natural state because they're preterm, and GI bleeding or gastrointestinal bleeding due to underdeveloped organs of fragile blood vessels isn't that uncommon. So if there's placental insufficiency to any degree, one of the compensation mechanisms that would be used by the baby is a phenomenon called brain spurring. So in order to make sure that the brain always has enough oxygen in a situation where there may not be sufficient to go around, other organs start sacrificing their need for oxygen to the superior need of the brain. And the biggest organ that suffers from that is the gut. Because remember, in utero, the baby doesn't really need the gut. So it's perfectly okay to borrow the oxygen from it if there's not enough going to the brain. But what that is doing all the time is building up damage to the mucosa. The lining of the gut is being damaged by this in utero lack of oxygen to the whole baby. This general hypoxia, this general lack of oxygen, also creates coagulation dysfunction. So the platelets and the clotting factors and all the things that are supposed to control bleeding inside us don't work as well in those types of situations. And in the case of baby E, we have vomiting from probably the upper GI tract. But we know that Lucy Letby had nothing to do with it because we had the mucky aspirates first. Remember the mucky aspirates? Now the mucky aspirates are almost certainly reflective of a compound called hematin. And hematin is a breakdown product of hemoglobin. And if you see hematin or coffee grounds in a vomit, they're going to represent bleeding that took place between 2 and 4 or even longer, but a minimum of 2 to 4 hours before you see them. So we remember in the case of baby E, there was this whole thing about the mother seeing bleeding around the mouth like a goatee beard. But it doesn't matter. I'm not saying she didn't see it or anything like that. But what she seen was old blood, and she even admitted herself that the blood was old. And that means that it's hematin. It's not blood, it's hematin. And it means that the bleeding started 2 to 4 hours before it became visible. That means it started before Lucy Letby came on shift. So Lucy Letby could not have harmed the baby, as Dowie Evans said, to cause the bleeding because the blood was too old. And if she harmed the baby when she was on the shift and caused fresh bleeding, it doesn't explain the old bleeding. So someone who isn't looking for malfeasance and making things up will look at the sequence and go, well, the first thing we saw here was the mucky aspirates, which represented old blood, and then we had acute bleeding on top of that, and that bleeding will get worse and worse as the baby used up the platelets and the clotting factors, and that will happen pretty quickly in a baby, a preterm baby. And then we have baby 6 or baby F. The prosecution said Letby attempted to murder baby F, that's the twin of baby E, by administering insulin. This is one of the insulin cases. And the panel ruled that the child's insulin levels and insulin C-peptide ratio did not prove that exogenous insulin was used and was within the norm of preterm neonates. Now, I've been a bystander or minor contributor to a WhatsApp group about this, and I bet you there's never been a wider discussion about insulin in the history of humanity, going on for months. But all we need to do is look at our data points, all the data that we have. And the data that we have shows that in these preterm babies, the variation of insulin C-peptide ratios is so wide that practically any number will fit into what you could find in any one of these babies. So the very fact that the baby only had one test is the ultimate Achilles heel of this conviction. The CCRC is going to have no option but to accept that that single test was not enough to prove that there was a process going on that was supposedly going on for 17 hours in that baby, because they had a snapshot of what was happening at the time that blood was taken. And that snapshot fits well within the limits of what you might find in a random blood test that you would take on any one of these babies any day of the week. In other words, no proof of malfeasance whatsoever. And then we had baby 7, that was baby G, and the prosecution said that Letby attempted to murder the baby girl by overfeeding with milk and forcing her down her feeding tube. Now, we've just talked there about pressures, intra-abdominal pressures, millimeters of mercury, how much air you would need and all that. And if you try to stack it all up, you just can't make it work practically in a neonatal unit. You would have to be working on the baby all the time to produce these effects, and someone's going to see you do it. These are not just do something, disappear, and let that effect build up. It just doesn't work that way. And the panel's finding was that there was no evidence to support air injection into the stomach or overfeeding, that the baby's vomiting and clinical deterioration were due to infection. And then we had baby 8 or baby H. The jurors cleared Letby of one count of attempted murder and failed to reach a verdict on the second count. The prosecution prosecutor said the nurse sabotaged the girl's care in some way, which led to 2 profound oxygen desaturations. And the panel said that the deterioration was due to medical mismanagement of a tension pneumothorax, where air is trapped between the lungs and the chest wall. Now, the telling word here is tension pneumothorax. So the tension pneumothorax is when the air gets between the lung and the chest wall, but it continues to do that. It's not a single event where you get a bubble of air trapped there and you can stick a tube in and relieve it. The air leak that created that bubble is ongoing, and you have to manage the air leak, which the panel are saying here that the Countess of Chester Hospital medics didn't manage to do. They failed to manage the tension pneumothorax. Then we had BB9 or BBI. Prosecution said Letby murdered the infant by injecting air into her bloodstream and stomach. The panel said it found no evidence of air injection and that the baby died of breathing complications caused by respiratory distress syndrome and chronic lung disease. And again, we have covered this. It is so obvious. And then BB10, that child, or BBJ, the jurors could not reach a verdict on an allegation of attempted murder. Prosecution identified no specific form of harm. Can you believe that? But they said Lucy Letby did something to cause the collapse of the girl. Hal said the deterioration was caused by sepsis. Yes, sepsis. And there was no evidence to support malicious airway obstruction. But we've got, as they would say here, a shit ton of evidence that there was sepsis in this ward. Then BB11 or BBK, the prosecution said that Letby attempted to murder the girl by deliberately dislodging her breathing tube. And among its findings, the panel said that there was no evidence to support a dislodged endotracheal tube, and the clinical deterioration was caused by the use of an undersized endotracheal tube, or at least I would say an undermanaged endotracheal tube. Sometimes, if, for example, you only had a 2mm ETT, you would have to use a 2mm ETT, but if you did, you would still have to manage it, and you might be able to get by. But we remember that Dr. Jeran said that he didn't pay any attention to the readings that were coming from the ventilator, which are feedback readings telling you what effect the size of the tube is having on the baby. But you can't manage it that way. And then we had baby 12 or baby L. The Crown said that the nurse poisoned the baby with insulin. The panel said that the baby's insulin C-peptide were within the normal limits for preterm infants, and there was no evidence of deliberate administration of insulin at all. So very like baby F, just made up stuff. With one reading, you simply can't do that. There's no dynamic. There's no way you can measure what's going on over a period of time from one reading. And no one should ever have been allowed to do that in a trial, to take one reading and say, we can extrapolate so much information from this one reading, because you cannot extrapolate all that stuff from one reading. It's a dynamic system. It's changing all the time. And this is an embarrassment, really. And again, BBL, BBF were the first two that Letby was found guilty of. They will also, in my opinion, be the first two that are kicked out. Then BB13 or BBM, prosecutors said Letby attempted to murder BBL's twin BBM by injecting air into the bloodstream. The panel said there was no evidence of air embolism, and his collapse was caused by sepsis or a heart problem. BB14 or BBN, the Crown said that the boy was a victim of attempted murder by inflicting trauma to his throat and air injection into his bloodstream. And the panel said there was no air embolism, and it was likely the blood oxygen levels dropped due to the haemophilia condition or routine care, which was exacerbated by repeated attempts to insert a breathing tube. And in these situations, it's very difficult. I remember doing 2 or 3 of these and absolutely hated it, because you've got 20 seconds to get that tube in there. And those 20 seconds are not like 20 seconds where you're counting yourself. They go by in the flash of an eye, and if you don't get the tube in, you have to get oxygen in before you try it again, and you need to have so much experience. It's great to see someone who does it all the time. They're so cool. They can time all the stuff in their head. It looks really easy. They can make it look easy, but sometimes they struggle. But when you're learning to do this stuff, when you're doing it under pressure for the first time, it's very, very difficult. And to leave junior doctors behind on their own, do all this stuff, was not very wise and not very fair on them. Then baby 15 or baby O, the prosecution said Letby murdered the triplet boy by injecting air into his bloodstream and inflicted trauma to his liver. Panel said he died from liver damage caused by traumatic delivery, resulting in bleeding in the abdomen and profound shock. Now you're getting people jumping up and down and going, oh well, the other guy said he stuck a needle in to the baby and that's what caused it. And they're just mixing up two things. What the panel of people have decided here, the best thing to do is go with the causal chain. So the first thing that happens is the injury of the subcapsular hematoma in the liver was caused by the delivery. Now, that doesn't mean that the obstetricians caused it. The delivery was an emergency section of a woman with triplets in labour. Probably one of the most difficult deliveries you're ever going to do. And the parenchymal damage, the secondary damage that was done or may have been done by the insertion of a needle into the liver, came after that event, long after that event. And the cause of death then was the initial subcapsular hematoma that led to all the problems, that led to all the interventions. And one of the interventions may have added to the speed with which the baby died or the way in which the baby died, but was not the cause of why the baby died. So just think causal chain. Then baby 16 or baby Q, who was the brother of baby O, the prosecution said Letby murdered baby O's brother by injecting him with air. The panel said there was no evidence to support that mechanism and that he died from a collapsed lung, which was suboptimally managed. And again, we remember in these babies the very high ventilation pressures, which somehow or other didn't get discussed during Letby's trial. And then the last baby, baby 17 or baby Q, the jurors could not reach a verdict on the allegation of attempted murder. Crown said Letby attempted to murder the boy by injecting liquid or possibly air down his feeding tube. Darry Evans again. The panel said there was no evidence to support air injection into the stomach, and the child deteriorated because he had early symptoms of a serious gastrointestinal problem. Or sepsis. And of course, the jury didn't know anything about the really hazardous sepsis risk in this unit. And that really begs the question for me, what the heck was Letby's defence really doing? And perhaps we'll do a controversial podcast on that. I don't know. I'll take advice from my old friend Peter Elston and see what we do with that. Then, just to keep Stuart Gillum happy, I'm going to have a go at Paul Hughes. Now, I'm reading this from iPaper, letter I paper, which I'd actually never heard of before. But anyway, we have Paul Hughes here now, Detective Superintendent Paul Hughes, coming in and making comments about not making comments, if you know what I mean. So let's go through this. Senior Investigating Officer Detective Superintendent Paul Hughes said of the claims, that's the claims from the panel, the investigation into the action of Lucy Letby, the trial process and the medical experts continued to face scrutiny and criticism, much of it ill-informed and based on a very partial knowledge of the facts and the totality of evidence presented in the court and the Court of Appeal. Now, I would have thought at this stage now that Lucy Letby's locked up, she's gone through the courts, she's gone through all of that systems now, that Paul Hughes has no role in this anymore. He's prosecuted successfully Lucy Letby. Now he has to leave the rest of the machine to tidy up after him. But he keeps going on. The case has been rigorously and thoroughly tested through 2 juries and subsequently scrutinised by 2 sets of appeal court judges. Lucy Letby's trial was one of the longest-running murder trials in British criminal history, and the jury diligently carried out their deliberations for more than 100 hours. It followed an investigation that had been running for 6 years, an investigation like no other in scope, complexity and magnitude. It was a detailed and painstaking process by a team of almost 70 police officers, and no stone was left unturned. But no matter what Detective Superintendent Paul Hughes wants to say, there have been a lot of stones left unturned. And had those stones been unturned before the trial, there wouldn't even have been a trial. But he carries on. As the case unfolded, multiple medical experts specialising in areas of paediatric radiology, paediatric pathology, hematology, paediatric neurology and paediatric endocrinology, and 2 main medical experts, consultant paediatricians, were enlisted to ensure that we carried out as thorough an investigation as possible. Now, I don't know about you, but this is beginning to sound like an excuse to me. He goes on, all are rightly regarded in their areas of expertise and were cross-examined while giving their evidence in court. The details of the case are clear and have been widely reported on. Following recent commentary, we have chosen not to enter into the widespread public debate surrounding this case, which is exactly what he's doing now. We remain respectful of the judicial process and mindful of the families who are at the very heart of this. But what Mark MacDonald and these experts are doing is participating in that system, in that judicial system that includes the CCRC, and what they're doing is perfectly lawful and perfectly reasonable. And it really doesn't warrant any comment from the police. They've done their job. Now it's up to other people to do their job. He goes on. In the closing statements of the Thirlwell Public Inquiry, the parents of the babies involved in the trial spoke of the significant impact the case continues to have on them a decade after experiencing such trauma and grief. Their dignity and composure in the face of intense public discussion with little sensitivity or humanity is remarkable. Well, again, I heard Professor Shuley say that he would be willing to meet with these families and explain to them face to face what he was doing and why he was doing it. And Paul Hughes says that their words, the family's words, are incredibly honest and powerful and must not be lost in a sea of noise. And I would agree with him, but we have to maintain the integrity of what we do. Then Paul Hughes makes an extraordinary remark. He says, there is a significant public interest in the reporting of this case, and everyone is entitled to an opinion. However, every story that is published, statement made, or comment posted online that refers to the specific detail of a live investigation can impede the course of justice and cause further distress to all of those involved. But this is not a live investigation anymore. This is a done and dusted investigation. And if there were no general concerns amongst the people who are making this noise, then it would be done and dusted. But sadly, that's not the case. Paul Hughes doesn't have any role in the Lucy Letby case anymore unless he wants to bring more charges, which he hasn't done. And when I say about maintaining the integrity of what you do, people have to go to the doctor every day of the week. And doctors, believe it or not, we may not seem involved in everything we do, but most doctors I know are involved in everything they do. But we can't carry it all. We have to get on with the job. You sit and you have a consultation with someone. It's a heartbreaking consultation, but there's another patient waiting on the other side of that door. And the whole point of the integrity of it is that you are always going to give those people the best evidence and the best advice that you can. And in order to do that, we have to make sure that people like Barry Evans that make stuff up are not given free license to run around making stuff up and destroying the integrity from what the rest of us are trying to do. There's an enormous difference between a difference of opinion between two doctors and inventing diseases like Barry Evans did, of taking the evidence base for everything that we say in medicine and shredding it like Evans did. And now we have 21 international experts, and I'm sure you could get 2,100 international experts if you wanted to say that what Evans said and did in court that turned out to be exactly what Lord Justice Jackson warned Justice Goss he would do. Create worthless evidence is unacceptable to most doctors, and it's unacceptable in society. That's my interest in this. That's many people's interest in this. Of course, we know that these families have suffered, and we know that they continue to suffer, and that they will likely suffer for the rest of their lives. But you don't heal suffering with more lies. You don't heal suffering by extending the injustice done to them to Lucy Letby. You get to the bottom of what happened, you tell the truth, and you fix the system. And as I say, I think Detective Superintendent Hughes' role in all of this is over unless he brings more charges. But if he ever did bring more charges, there would be an entirely different set of experts and an entirely different approach to how this evidence that Barry Evans cooked up ever made its way into court. The British government is known for a long time, and they've written multiple reports to change the way that these experts are allowed to give evidence. And if ever there was a case where that now has to be brought to fruition, this is the case. The Lucy Letby case, the only benefit that everyone can get from it is that the rules on experts giving evidence is finally changed so that this type of thing can't happen again. And I think one of the things that the British government could do tomorrow morning is to say, okay, we're going to create a list of people who are experts, and they're going to be randomly allocated to each case. And none of them are going to take part in the investigation of the case. They're going to go to court and they're going to answer questions that a jury might not understand. And the prosecution doesn't get to pick who they want, and the defense doesn't get to pick who they want. Like in many European countries, they are court-appointed experts. They get paid no matter what they say. So that's the end of episode 72. I hope you got something from that. And we'll see you in the next episode. And we'll have to see what happens with the CCRC. So I'll see you then.